Okay, so first aid. So what is first aid? First aid says here is help given to a sick or injured person until full medical treatment is available. Basically, basic medical help until full medical help is provided or available. So now let's say that someone fell over in front of you. Let's call them Alice. Which of the following options display first aid so that we can help Alice? A. Walk around them. B. Walk on them. C. Yell at them. Or D. Help them out and call for medical attention. While a lot of you may think that the answer is B. Walk on them, it's actually D. Help out and then call for medical attention. This displays first aid, helping out until professional help arrives. So now, why is first aid important? Well, let's say that we have the person that fell over again. If you didn't help them, they might get hurt even worse when professional help arrives because they weren't tended to in time. So, performing first aid before medical help arrives could really help them out so that they're a lot healthier and so that they don't have to spend a lot of money on treatments. What are some rules of first aid? Well, the rules are to call 911 if needed, that you need to be professionally trained. However, some states do allow anyone to perform CPR, and to not move an injured person. And these are the essential rules of first aid. So, how do you perform first aid? Well, first check the scene for safety. Then, if the person is unresponsive, check for responsiveness. If the person isn't responding, call 911 or whatever the emergency phone number is in your area. Then give care based on the conditions and your level of care. If they are not responsive and not breathing, perform CPR and use an AED if possible. However, if they are responsive, interview the person or bystanders and ask about symptoms, allergies, medications, and medical conditions. Do a focus check based on what the person told you, how the person is acting, and what you see. Do not ask the person to move if you suspect a head, neck, or spinal injury, and do not ask the person to move any area of the body that causes pain or discomfort. Remember that as you check the person, take note of any medical identification tags. Now you can apply this to real life. You can help that person that fell over. You can save that person that's in front of you. You can save lives.